Hey guys, we have been spending this month talking about arthritis, and we discussed the three types of arthritis that I really wanted to focus on. Last week, we really dissected the type of arthritis that begins from the autoimmune process, so rheumatoid arthritis. And we talked about possible root causes for that autoimmunity, trigger foods, trigger stress or infection, and ways to handle that process. Then the second type of arthritis that I wanted to review is osteoarthritis. And then finally, there's a third type that's more, the root cause of the third type would be something like a virus, and a virus that your body is not able to sort of keep at bay. So let's dive into osteoarthritis. And there's many possible root causes for osteoarthritis as well. And the further we can get to the bottom, to the root cause of these issues, then the more we know how to address them and resolve them and feel better. So the possible root causes for osteoarthritis are things like chronic inflammation, which chronic inflammation, right? The inflammatory response is when your body is sending out immune cells to get rid of something. Now that can happen if you have a chronic inflammation going on in your gut. So a gut issue might be where you have a little bit of an imbalance in the bacteria that live in your gut, and all of a sudden you have one sort of weed that's crowding out the rest, and that's considered an inflammatory or imbalance in the gut microbiome. And symptoms of that would be irregular bowel movements or GI distress after eating, like bloating, or heartburn or any of those. So if you have those signs of GI distress, then that could lead to inflammation throughout the rest of our body, including by our joints. So that's something to think about addressing. Other possible chronic inflammatory responses that would lead to joint pain would also be the inflammation that happens from stress. Now I'm talking about emotional stress as well as the stress of overuse. So I know this could happen over a lifetime of just overusing our joints, and that could eventually lead to inflammation and pain. Other possible causes for that inflammatory response that is impacting the joints are nutrient insufficiency. So if you are missing a certain nutrient like magnesium or some of the vitamins that we need to reduce inflammation, if you're missing something like that in your diet, then that can cause a chronic inflammatory response leading to joint pain. And so can eating a more inflammatory diet. So the standard American diet, which is high in sugar and saturated fats and processed foods, that can also cause inflammation leading to joint pain. So it's important to think about which of these processes could be taking place for you and addressing that in order to reduce and reverse the arthritis. If you've had a past injury and you have scar tissue, that's another possibility for that inflammatory response. And there are things that you can do about that, but that does include more, sometimes supplements and things like that. And it probably would be helpful to meet with a practitioner who would know what to recommend if you are dealing with scar tissue. That's something that you probably need a little more individualized attention for. So it's as I've always discussed, it's very important to recognize the root cause of these conditions in order to understand how you can benefit and reverse those conditions. Some really helpful hints that are very modifiable are: number one, to eat a anti-inflammatory diet that is nutrient diverse and nutrient dense. So what does that mean? Anti-inflammatory means high fiber, so that you're pooping every day. High fiber, lots of fruits and vegetables and nuts and seeds, unprocessed foods where you recognize all of the ingredients on the label. It's also important to include the omega-3 fatty acids, which is what you get when you eat fatty fish. Now, it is not true that you get the preformed, the type of omega-3 fatty acid that your body needs. You do not get that from seeds. I know everyone thinks that flax seeds are your example for people who are vegan to get your omega-3 fatty acids, but that is not the case. Seeds have the precursors for fatty acids, but they have to be converted in your body to the omega-3 fatty acids that your body could use. And that process of conversion is not simple. So not everybody is able to do it. So if you are struggling with a little bit of joint pain, having those healthy fats in your diet is very important. So the fatty acids that you get from fatty fish. And then other really healthy fats are the ones that you get from olive oil, high quality olive oil, that you know for sure is pure and is I actually can give you a list of the more high quality olive oils that have been tested for purity. Avocado is another one. So having those healthy fats in the diet is really important because that fat is necessary for membrane fluidity. So that is why the fats are really important for that. Also, making sure you are drinking adequate water. So a good rule of thumb is half of your body weight in ounces of water per day. That's how much water you should be drinking every single day. And if you find that you're one of those people that you're constantly drinking water but you stay thirsty, then it's possible that you need electrolytes like magnesium and potassium and even a little sodium to help the water move into your body's cells and so that you get better hydrated. So you could ask me, I could let you know there are certain electrolyte powders that you could include in your water. It even helps it makes it more flavorful, and it adds some of those electrolytes to your water so that you know for sure that the water is moving into your cells and that your body is getting well hydrated. So just as a reminder, half of your body weight in ounces of water per day. That's how much water you should be drinking every single day. So an anti-inflammatory diet, really good hydration, making sure you're pooping every day, making sure you're getting high quality, good, deep sleep every night, because sleep is when our body is releasing all those antioxidants that clear away inflammation. So very important that you get into that deep stage of sleep so that the inflammation can get cleared away. And movement. Even if I know it feels like it's painful, but just stretches and things like yoga or Pilates or weightlifting, resistance exercising, moving is especially important for the health of your joints. Now, there's one more that I didn't get too deep into and I really wanted to focus on, and that is if you have insulin resistance. How do you know if you have insulin resistance? That would be if you've ever been told that your fasting blood sugar was on the higher side. So when you look at your blood work and you see the glucose, if you see that it's in the 90s and moving towards 100, if your HbA1c is also on the higher side, these are all signs that your body is struggling with controlling your blood sugar. Now, when your body struggles with moving blood sugar out of your blood and into your cells, then your body is going to send out more insulin because insulin is what is needed to do that process. Now, what research has shown is that insulin actually accumulates in your joints and leads to arthritis at some point in life. So controlling blood sugar and controlling your weight are two very important aspects of making sure you have healthy joints and really reducing that pain in your joints. So finally, the last point I wanted to discuss is supplements, because people really want that one pill that's going to make this all better. And unfortunately, there aren't any pills to really make arthritis just go away. And especially even if there were, you would be just treating that symptom and not really getting to the root cause. There are some supplements that are helpful at addressing the root cause, but they're very individualized, and it would be helpful if you worked with a healthcare professional to know which supplement is appropriate for you. And those supplements would not be the one and only answer. You would have to implement these other lifestyle factors that I've already discussed, and the supplements would sort of just be the last step you're taking. But some thoughts on it could be a really high quality, healthy omega-3 fatty acid, sometimes magnesium, sometimes curcumin, sometimes chondroitin and glucosamine, and sometimes collagen. Collagen powder is sometimes good. But again, I'm careful about saying these things because there are times where an omega-3 fatty acid would do more harm than good. And there's certainly times where curcumin supplement can also do more harm than good. So please don't just run out to the store and buy these supplements and think that they are the answer without really consulting with somebody who could assess your individual situation and help you understand what is appropriate for you. Okay. So quick review of everything that I talked about. Oh, and there's one more, sorry. If you have any food intolerances, if there's a specific food that you feel is giving you some more distress, or you feel a little bit more bloated when you eat those foods, it's important to remove those foods from your diet. So things like gluten and dairy, corn and soy are common food allergens. And even if you don't know those foods are causing you some sort of discomfort, it may be helpful to remove those foods for a set period of time, like 3 or 4 weeks, and see if you feel better. And then at that point, you can reintroduce just one at a time to see how your body reacts. And that would tell you if one of those foods was possibly causing a problem. Sometimes nightshades is another issue for arthritis, and nightshades are foods like tomatoes, peppers, eggplants. Those are some big ones that sometimes cause problems for people with arthritis. So now I can review. Osteoarthritis is usually due to some type of chronic inflammatory response, which could be from the gut. It could be from long overuse and stress. It could be from scar tissue from a previous injury. And it could be from a nutrient deficiency or an inflammatory diet, or eating a food that is your body is reacting to that you might not even know about. And it also could be very much due to a lack of good blood sugar control and increase of insulin secretion in your body. So knowing which one of these could be the issue for you would then help you know how to address it. So controlling your blood sugar, eating a really healthy anti-inflammatory diet that includes the good healthy fatty omega-3 fatty acids, high fiber, making sure you're pooping every single day, Drinking a lot of water. That's really helpful. Half of your body weight in ounces of water. And you may even want to consider adding electrolytes to that water so that you know the water is moving into your cells and you're getting well hydrated. Controlling your blood sugar, reversing any type of imbalance or dysbiosis in your gut, imbalance of the bacteria that live in your gut. Good sleep, good movement, and trying to reduce your stress. So taking time every single day to manage and give yourself some moments where you're just clearing your mind and feeling calm. That's really important. I hope that this was helpful for you, and I look forward to the next topic. I think we're going to talk a little more about arthritis. I'm not 100% sure because that last one on virus is not as nutrition related, but we will talk about it maybe. Have a good week, everybody, and I'll see you next time.